Too many times in this Congress, we have seen legislation pass along party lines. Today, Americans view this as one of the most polarized Congresses that they have seen. However, we have seen some moments of bipartisanship in this Congress. Last fall, while debating the Democrat health care bill, there were 64 Democrats that joined with 176 Republicans to favor the Stupak-Pitts amendment. This amendment prohibits the federal funding of abortions in the new health care bill, as has been the case with the Hyde Amendment in Medicare and Medicaid. Unfortunately, there are some that would disregard the bipartisan vote that we had in November, the long-standing established precedent, and the will of the American people by removing the Stupak-Pitts amendment from the health care legislation that our committee is considering today. The issue is not the legal status of the unborn child. It is simply on the question of compelling taxpayers to underwrite abortions. It has been a long-standing federal policy not to fund plans that cover abortions, such as in the Federal Employee Health Benefits Program, Medicaid, and S-CHIP. The Senate health bill the House plans to take up actually uses an accounting gimmick to separate private and public funds for health plans that provide abortions. Government funds will simply help these plans reduce their premiums, essentially subsidizing abortions. This is a clear departure from the precedent and contradicts the will of the American people. In fact, when we began this debate just about a year ago, there was a Gallup poll that found that President Obama's decision to restore funding to overseas groups and promote abortion had only 35% support, the lowest of any administration policy they tested. Last November, right after the vote on 3962, CNN found that 6 in 10 Americans oppose federal financing of abortion. Provisions in this current bill permit taxpayer subsidies to private health plans that allow abortions. While some would claim that the funds will not be used for abortion, it is merely an accounting scheme that separates private and public dollars.